Welcome to ER Mentorship Hub. Today, we're diving into a crucial topic in neonatal care, neonatal conjunctivitis. A condition that's not just common, but also a potential threat to a newborn sight. Neonatal conjunctivitis, also known as ophthalmia neonatorum, can occur during birth or shortly after. It presents as a severe inflammation of the conjunctiva, the delicate membrane covering the eye. Let's understand how it happens. During birth, as the baby passes through the mother's cervix and vagina, they can be exposed to infectious agents. Additionally, cross-infection after birth is also a risk. The symptoms vary based on the causative agent. For instance, Neisseria gonorrhoeae infection leads to a hyperacute bilateral conjunctivitis. It's marked by copious purulent discharge, lid swelling, and preauricular adenopathy. Other common pathogens include chlamydia trachomatis, herpes simplex virus, and various bacteria like Staphylococcus aureus. Chlamydial conjunctivitis ranges from mild swelling and watery discharge to severe symptoms with blood-stained discharge. Management is crucial. In the emergency department, a gram stain and culture of the palpebral conjunctiva are key diagnostic steps. For suspected gonococcal conjunctivitis, immediate treatment and hospital admission are necessary. Scraping of the palpebral conjunctiva in a newborn is a delicate procedure used for diagnostic purposes, primarily to identify the causative agent of conjunctivitis. Here's a step-by-step description of how this procedure is typically performed. 1. Preparation and consent. Before the procedure, the healthcare provider ensures all necessary equipment is ready. This includes a sterile cotton swab, gloves, and a microscope slide or culture medium for sample collection. If the situation allows, parental consent is obtained, explaining the procedure's importance and what it entails. 2. Positioning the newborn. The newborn is placed in a supine position, ideally with the head slightly elevated. It's important that the baby is calm and still during the procedure, which may require gentle restraint or the assistance of a nurse or parent. 3. Eye examination. Before taking the scraping, the healthcare provider conducts a preliminary examination of the eye to assess the extent of conjunctival inflammation and discharge. 4. Anesthetizing the eye, if needed. In certain cases, a mild anesthetic eye drop may be used to minimize discomfort. However, in newborns, this step is often skipped due to the minimal discomfort caused by the procedure. 5. Eversion of the eyelid. The lower eyelid is gently pulled downwards to expose the palpebral conjunctiva. In some cases, the upper eyelid may also need to be averted, but this is less common in newborns. 6. Taking the sample. A sterile cotton swab is gently brushed over the conjunctiva to collect cells. Throughout the procedure, utmost care is taken to ensure the comfort and safety of the newborn. The procedure is quick, but requires skill and gentleness to be performed effectively. If you are not comfortable doing the procedure, it is better to ask for senior or specialist assistance, rather than causing injury or taking a sample that cannot yield results. Treatment varies by causative agent. For example, chlamydial conjunctivitis requires specific antibiotics, while herpes simplex conjunctivitis needs intravenous acyclovir and topical medication. It's also essential to evaluate the newborn's parents, especially in cases caused by gonococcus, chlamydia, or herpes simplex virus. Remember the rule of fives to help predict the most likely bacterial cause. And be aware that untreated gonococcal eye infection can lead to blindness and is one of the few emergency conjunctival infections. 0 to 5 days it is likely gonococcus. 5 days to 5 weeks it's most likely chlamydia. 5 weeks to 5 years it may be staphylococcus, streptococcus or Haemophilus. Please have a look at this table detailing the different etiologies and treatment strategies. It would be good to take a screenshot for future reference. A key differential diagnosis to consider is nasolacrimal duct obstruction, common in newborns and often mistaken for conjunctivitis. That's all for today on neonatal conjunctivitis. Remember, early diagnosis and appropriate management are key to preventing serious complications. Join us next time for more insights into emergency medicine. Like, share, and subscribe to ER Mentorship Hub for more informative content. Hit the bell icon for notifications on our latest videos. Until next time, keep learning and stay informed.